Have you ever felt concerned when you notice a loved one or friend frequently forgetting familiar things, such as the names of family members or important life events? Have you ever noticed them repeating a story that you've heard many times before? These may seem like small signs in daily life, but sometimes they are early warnings of a more serious issue: Alzheimer's disease or dementia. With over 6 million Americans living with Alzheimer's, this disease not only affects the individuals diagnosed, but also creates worry and stress for their loved ones. Alzheimer's is one of the leading causes of memory loss and cognitive decline in older adults. However, some early signs of the disease are not easy to detect and are often overlooked or mistaken for normal aging. In this article, we will explore 10 early warning signs of Alzheimer's disease that you should not ignore. These symptoms may appear very early, even before the disease progresses to a serious stage. Timely recognition and action. When you notice these signs, can provide you or your loved ones with better treatment opportunities, helping maintain independence and a high quality of life for a longer time. So, if you are concerned about the health of an elderly family member, or even noticing signs in yourself that you can't explain, don't miss this article. The information we share will help you better understand the warning signs of Alzheimer's and make informed, timely decisions. Follow the Senior Health channel to always receive useful information about senior health. Don't forget to hit like and comment below if you find this information helpful. Share this article with your loved ones so they can recognize the early signs of Alzheimer's and better protect their health. Let's begin the journey of recognizing the early signs of Alzheimer's now. Alzheimer's is a neurodegenerative disease that primarily affects memory, thinking, and other cognitive functions. It is the most common cause of dementia in older adults, accounting for about 60–70% of all dementia cases. Although scientists have not yet pinpointed the exact cause of Alzheimer's, several factors and mechanisms are believed to be associated with the development of the disease. One of the main causes is the accumulation of abnormal proteins in the brain, such as amyloid beta and tau. These proteins lead to the buildup of plaques and tangles in the brain, disrupting the function of nerve cells, resulting in memory decline and other cognitive issues. This process may begin early, even years before clear symptoms appear. Additionally, genetic factors also play an important role. People with a family history of Alzheimer's have a significantly higher risk compared to those without such a history. Genes like APOE4 are believed to be associated with an increased risk of the disease, although not all individuals with this gene will develop Alzheimer's. While not all risk factors for Alzheimer's can be changed, such as genetics and age, there are several lifestyle factors we can control that may help reduce the risk of developing the disease. Age. Age is the biggest risk factor for Alzheimer's. The risk increases with age, particularly in those over 65 years old. However, Alzheimer's is not an inevitable part of aging. Many older adults maintain good memory and cognitive abilities if they lead a healthy lifestyle. Genetics. As mentioned, people with a family history of Alzheimer's have a higher risk of developing the disease. However, genetics is only a risk factor, not a definitive cause. Other genes besides APOE may also influence the likelihood of developing the disease. Lifestyle and habits. Several studies have shown that healthy habits, such as maintaining a balanced diet, exercising regularly, and engaging in mental activities, can help reduce the risk of Alzheimer's. On the other hand, habits like smoking, excessive alcohol consumption, poor diet, and lack of exercise can increase the risk of developing the disease. Other health conditions. Conditions such as cardiovascular disease, type 2 diabetes, high blood pressure, and high cholesterol can increase the risk of Alzheimer's. People with poor health may face issues related to blood and oxygen circulation to the brain, which can elevate the risk of cognitive decline. Living environment and social conditions. Factors like deprivation, loneliness, and lack of support from family or community can contribute to the development of Alzheimer's. A deprived living environment and lack of social interaction can impair cognitive abilities and increase the risk of developing the disease. Early detection of Alzheimer's symptoms is incredibly important. If identified in the early stages, the disease can be managed, and treatment options can help improve the patient's quality of life over an extended period. Although there is currently no cure for Alzheimer's, early treatment can slow the progression of memory and cognitive decline. Moreover, early detection allows patients to prepare mentally and make long-term plans for the future. This may include financial planning, identifying appropriate caregivers, and preparing for important medical decisions as their health condition changes. The importance of early detection also extends to supporting families and loved ones. When the early signs of Alzheimer's are recognized, families can seek help from professionals to receive support in caring for the patient. Furthermore, early detection helps alleviate anxiety and stress for both the patient and their family, knowing that they are receiving the proper care and support. In conclusion, recognizing and taking action when detecting signs of Alzheimer's is crucial not only for improving the patient's quality of life, but also for helping family members better prepare for the upcoming changes. In this section, we will explore in detail the 10 warning signs of Alzheimer's that you should not ignore. These signs can be very subtle and easily confused with the natural aging process, but if you notice any of the following signs in a loved one or yourself, be cautious and seek advice from experts. Sign 1. Memory loss. Memory loss is the most common sign and can be an early warning of Alzheimer's. However, it is not always easy to differentiate between normal forgetfulness and memory loss due to Alzheimer's. In Alzheimer's, patients often forget important life events or recent conversations and struggle to recall new information. It is important to pay attention to the frequency and severity of memory loss. In Alzheimer's, forgetting happens frequently and impacts daily functioning. For example, a person may forget appointments or things they recently used. This is not the same as occasional forgetfulness due to stress or lack of sleep. If a loved one or you experience this, try writing down a to-do list or use digital note-taking tools to minimize forgetfulness. Sign 2. Difficulty performing familiar tasks. People with Alzheimer's often struggle with tasks they used to perform naturally, such as cooking, driving, or paying bills. A person who was once proficient in daily activities may have difficulty completing these tasks, even if they are simple. For example, the patient may forget how to prepare a dish they have cooked thousands of times, or may not remember how to use household appliances, like the washing machine. These changes can lead to frustration and anxiety. Create a supportive environment and plan to help the patient maintain their independence for as long as possible. Label household items clearly or break down complex tasks into simpler steps. Sign 3. Difficulty communicating. Difficulty communicating is a common sign of Alzheimer's. The patient may have trouble finding the right words or using incorrect words to express their ideas. A conversation can be interrupted when the person cannot remember the word they want to say or repeats phrases without realizing it. Families may notice that the person sometimes changes topics in the middle of stories or is unable to follow a long conversation. This can lead to feelings of self-doubt and make it harder to maintain social relationships. Be patient and help the person maintain conversations gently. If the patient cannot remember a word, you can assist them by suggesting alternatives or guiding them back to the original topic. Sign 4. Disorientation and confusion. Disorientation is a warning sign of Alzheimer's that is often seen. The patient may get lost in familiar places, such as in their home or around their neighborhood. They may forget familiar addresses or struggle to identify the correct time and place. For example, the patient may go out and forget how to get back home or be unable to recall the time of day. This occurs due to the cognitive decline and reduced orientation ability in the brain. If you notice this sign, help the patient establish a fixed daily routine and always have someone accompany them when going out. Make sure they always carry important information, such as your phone number or identification details, in case they get lost. Sign 5. Impaired judgment when suffering. From Alzheimer's, patients may have difficulty making decisions. They may make poor choices, such as overspending, or be unable to decide what to do next in a given situation. Impaired judgment is a clear sign as the disease progresses and is often accompanied by a decline in the ability to manage finances, maintain social relationships, and make simple decisions. Try to assist the patient by making joint decisions, especially those related to finances. You may also consult experts for help managing finances and legal matters. Sign 6. Withdrawal from social activities. A clear sign of Alzheimer's is a change in social behavior. The patient may withdraw from social activities they once enjoyed, such as meeting friends or attending family gatherings. They may feel self-conscious about communication difficulties or simply lose interest in activities they once found enjoyable. Encourage the patient to participate in light social activities and support them during conversations. Through community engagement, they may feel more connected and reduce feelings of loneliness. Sign 7. Mood and personality changes. Alzheimer's can cause significant changes in the patient's mood and personality. They may become easily irritated, anxious, or even depressed. These changes can occur suddenly and without explanation, making it difficult for the patient to communicate with those around them. For the patient, emotional support and creating a quiet, safe environment are very important. Family members should be patient and understand that these changes are due to the decline in brain function. Sign 8. Difficulty planning and solving problems. One of the first signs of Alzheimer's is a decline in the ability to plan and solve problems. The patient may be unable to manage simple tasks, such as remembering important tasks for the day or prioritizing tasks. They may also struggle with calculating numbers or following steps in a process. To help the patient, create a clear plan and support them in managing tasks. Breaking tasks down into simple steps will help them maintain independence for a longer period. Sign 9. Putting things in unusual places. People with Alzheimer's often forget where they place objects and sometimes put them in places they cannot. Recall. They may search for items in inappropriate locations or even suspect others have taken their belongings. This sign is part of the decline in memory and cognitive function associated with the disease. Try to create an organized and tidy environment for the patient. Place items in fixed, easily recognizable spots so that the patient can easily find them. Sign 10. Changes in sleeping patterns. Changes in sleeping habits can also be a warning sign of Alzheimer's. The patient may wake up in the middle of the night or have difficulty maintaining sleep throughout the night. They may also experience insomnia or sleep excessively during the day. These changes can affect the patient's overall health and quality of life. Help the patient maintain a regular sleep routine by creating a quiet sleeping environment, avoiding sleep disturbances like bright lights or noise. As you can see, Alzheimer's can manifest in various signs. Early identification of these signs is crucial to take timely action and ensure that the patient receives appropriate care and treatment. In the next section, we will discuss action guidelines and solutions to help prevent and improve the health of people with Alzheimer's. When recognizing the signs of Alzheimer's disease or other cognitive issues, timely and strategic action is crucial to minimize the progression of the disease and improve the quality of life. In this section, we will explore the necessary steps to support individuals with Alzheimer's and healthy habits to prevent the disease. Take the patient to a specialist. When noticing unusual signs, the first step is to take the patient to see a doctor or neurologist. Doctors can conduct cognitive tests, exams, and accurately diagnose the condition. This helps identify Alzheimer's at an early stage or rule out other causes that may lead to similar symptoms. An accurate diagnosis is crucial for planning treatment and care for the patient. While there is currently no cure for Alzheimer's, many treatment methods and support strategies can help the patient maintain a better quality of life for many years. If you suspect that your loved one may have Alzheimer's, do not hesitate to see a doctor as soon as possible. Early diagnosis can create more opportunities for effective treatment, create a safe living environment. One of the key factors in helping Alzheimer's patients maintain long-term independence is creating a safe and supportive living environment. Below are some ways you can do this. Reorganize the living space. Tidy up the house and organize items to help the patient avoid disorientation. Essential items should be placed in fixed, easily recognizable spots. Improve lighting and view. Reduce the risk of falls. Ensure the living space is well lit, especially in areas like stairs, corridors, and places where falls are more likely to occur. Use night lights or motion sensor lights to avoid darkness and help the patient move easily at night. Create a clear schedule. Set up a daily routine to help the patient maintain habits. This also helps the patient feel safe and follow the planned activities. Let the patient participate in organizing their living space to maintain a sense of control and reduce feelings of anxiety and stress. Maintain physical activity. Regular exercise not only helps improve physical health, but also plays a significant role in maintaining brain health and reducing the risk of Alzheimer's. Research has shown that physical activity improves blood circulation to the brain, reduces stress and enhances mood, thus slowing cognitive decline. Appropriate exercises. Alzheimer's patients can engage in gentle exercises like walking, yoga, or stretching exercises. Exercise sessions can start with 20-30 minutes a day and gradually increase if the patient feels comfortable. Establish a routine. Create a daily exercise routine so the patient can maintain stability in their life. Exercise not only improves physical fitness, but also supports the patient in maintaining autonomy. Consult a doctor before starting any exercise regimen, especially for Alzheimer's patients with other health issues. Maintain a healthy diet plays a crucial role in preventing Alzheimer's and supporting brain health in patients. Research has shown that diets rich in antioxidants, omega-3s, and vitamins can help protect the brain from degeneration. Brain-boosting foods. Foods like salmon, sardines, nuts, leafy greens, berries, and olive oil are great choices to enhance brain health and reduce the risk of Alzheimer's. Avoid harmful foods. Foods high in sugar, salt, saturated fats, and processed foods can negatively impact physical health and may increase the risk of memory decline and cognitive issues. Stay hydrated. Drinking enough water daily is also essential, as dehydration can affect focus and cognitive function. Work with the patient to develop a healthy diet that includes a variety of nutritious foods to support brain and body health. Encourage mental activities. In addition to physical care, maintaining mental activities is crucial for Alzheimer's patients. Mental exercises stimulate the brain, maintain cognitive function, and improve memory. Reading, puzzles, and board games. These activities help improve memory and thinking skills while also providing enjoyment and boosting the patient's confidence. Learn new skills. Encourage the patient to try learning a new language, playing a musical instrument, or engaging in creative activities like painting or crafting. This keeps the brain active and helps prevent forgetfulness. Social interaction. Encourage the patient to participate in social activities like meeting friends, family, or joining clubs. Social interactions can help improve mood and reduce feelings of loneliness. Engage the patient in mental activities they enjoy and can sustain over time to support brain health and improve quality of life. Preventing and treating Alzheimer's relies not only on a single therapy, but also on a combination of several factors. Creating a safe living environment, maintaining a healthy diet, exercising regularly, and encouraging mental activities are essential steps to support Alzheimer's patients in maintaining independence and improving quality of life. In the next section, we will summarize the key points and provide recommendations for patients and their families. Alzheimer's disease is a serious condition that affects the patient's memory, cognition, and ability to communicate. Although there is no cure at present, early recognition and treatment can help slow the progression of the disease and improve the quality of life for the patient. In this article, we have explored the important warning signs of Alzheimer's disease, from memory loss, difficulty in communication, to changes in mood and daily habits. If you notice any of the warning signs of Alzheimer's in yourself or a loved one, do not wait until the condition becomes more severe. Act promptly to receive timely medical support and help the patient maintain the best possible quality of life. Get a medical checkup. If you or a loved one exhibit signs of Alzheimer's, Do not hesitate to see a doctor or neurologist. An early diagnosis can help you plan more effective treatment and management of the disease. Comprehensive care. Create a healthy living environment that supports the patient, including a proper diet, regular exercise, and participation in mental activities. Any small change in daily life can help slow the progression of the disease. Enhance social connections. Encourage the patient to maintain social relationships and engage in community activities. Communication and participation in activities will help reduce feelings of loneliness and stress, keeping the patient's mind at ease. Share this information. Share this article with family, friends, and loved ones so they can also recognize the signs of Alzheimer's and act promptly if necessary. Finally, remember that brain health care is a long journey that requires patience. Do not overlook the early signs of Alzheimer's and start today to protect the health of yourself and your loved ones. A good care plan will help you or your loved one maintain a healthy and meaningful life. If you find this information helpful, don't forget to subscribe to the Senior Health channel and comment on the post below to share and create a healthier community together. Together, we can help and support each other on this journey. Alzheimer's is a serious disease but can be controlled and slowed down if detected and properly cared for early on. Recognizing early signs, making lifestyle changes, and maintaining continuous care can help patients live better and reduce the impact of the disease on their quality of life. Act today to protect the brain health of yourself and your loved ones. Thank you for reading this article. Please share it with those around you to raise awareness and live healthier together.